In the midst of a national outbreak of the measles, Montana has seen its first cases in 35 years. The outbreak in Gallatin County included 8 people, both children and adults, who had recently traveled and brought the virus back to Montana. While health officials were able to contain the spread this time, Montana PBS's Anna Rao reports that falling vaccination rates and gaps in knowledge have experts worried about the next outbreak.
Missoula representative and pediatric Dr. Melody Cunningham just finished her freshman session as a Montana lawmaker. And she's already working the doors for re-election. Representative Cunningham has some unfinished business in the State House.
I knew that it was going to be a struggle. It was my #1 priority bill. The intent of this bill is to restart the flow of information from schools to DPHHS.
Representative Cunningham is talking about her bill that would have required school districts to share anonymous vaccine data with health officials and the public. In 2021, the legislature struck that requirement, and now county health departments and the Montana Department of Public Health and Human Services are in the dark on vaccine rates in Montana schools. Montana is the only state in the nation that doesn't report those numbers.
Let's get the information that the schools by law have to collect and get it to DPHHS so that we can know where there are vulnerabilities. Because people are trying to go about and live their lives, and some are afraid that they or their infant who cannot yet receive a vaccine could be exposed.
I think that parents just feel helpless of new babies. They feel like, well, how am I supposed to function and do the daily things? How am I supposed to, go to the grocery store?
Dr. Addie Moriarty is a Missoula pediatrician and the president of the Montana chapter of the American Academy of Pediatrics. She says many new parents are alarmed by the recent measles cases in Bozeman. They want to know what the risk is in their community and how they can protect their baby. But she says other parents don't seem to be as worried.
We have been fortunate to have eradicated many of these diseases, and so we're not scared of them anymore in the way that we used to be.
I think we forget that diseases have consequences when we don't see them very often.
But Dr. Cunningham and Dr. Moriarty say people should be concerned because for some, the measles is not just a fever and a rash.
Patients die from measles. So kids can die from measles, particularly younger patients, pregnant moms, and then there are other complications of that: premature birth, miscarriage, low birth weight. It can also cause what's called encephalitis, so fancy name for brain swelling that can cause seizures and other complications.
The numbers are sobering. According to the Centers for Disease Control, roughly a quarter of unvaccinated children who get the measles will be hospitalized. 1 in 10 children will suffer ear infections that can cause permanent hearing loss. 1 in 20 unvaccinated children with the measles will develop pneumonia. 1 to 3 children in 1,000 will develop encephalitis that can cause brain damage, seizures, and deafness. And 1 to 2 children per 1,000 measles cases will die. And more recently, Harvard researchers discovered that the measles causes what's known as immune amnesia.
It can erase the immunity we've seen from other illnesses. So if kids have seen RSV, if they've seen all of the viruses that cause the common cold, it erases that immunity so then they can get all of those again.
Data shows that particularly among children, young children under the age of 5, that they can have more severe symptoms.
Laura Williamson is the state epidemiologist with the Montana Department of Public Health and Human Services. She says not only is the measles a serious disease with terrible complications, it's also extremely contagious.
It's an airborne virus, and it can linger in the air and on surfaces for up to 2 hours after a person has, say, left the room.
It's contagious without symptoms at least 4 days before the symptoms come on. It is one of the most contagious viruses we have. 9 out of 10 people exposed to someone with measles will contract measles if they're or under vaccinated.
Anything less than a 95% vaccination coverage in a specific community opens ourselves up for an outbreak.
It's important that public health authorities have access to aggregate information so they can track where vaccinations are not being used.
Explaining the contagiousness and the complications convinced lawmakers in the House that releasing school vaccine data is a good idea, that it would help experts and the public assess the risk in the face of a measles outbreak. Cunningham's bill passed by a 66-31 vote. But things changed when the bill hit the Senate floor for debate.
This particular bill is not needed.
This is meddling.
This is government intrusion, overreach. I will not comply.
Montana has a very high vaccination rate. Currently, this is 2022, 95% of children are vaccinated for the requirements that we require in schools. It's very high.
There was a lot of controversy and things that were said and asked that were incorrect. So, for example, we have a vaccination rate of 95%. Well, we don't know that at this point. Perhaps at some point we did when we had the information, but we don't know that now.
Representative Cunningham suspects the vaccination rates are probably lower, especially in some Montana communities. She points to recent changes in Montana law that have made it easier for parents to get medical exemptions for their children.
It is not simply physicians, it's a much broader group who are able to give vaccine exemptions. So any healthcare provider who provides vaccines is able to provide an exemption.
Among school-age children, the number of children who are up to date with their vaccines has been declining since the pandemic.
I have talked to some of the surrounding counties who are concerned that their vaccination rate is not up to that level to acquire herd immunity. And they're worried. The healthcare providers there are worried because if we have an outbreak, we're going to lose kids.
Brooke Krininger is the nursing supervisor for Missoula County Public Schools. She takes little comfort in the fact that the Gallatin County outbreak was contained so quickly, and she says the risk for unvaccinated Montana children is far from over.
North Dakota, a community over right on the border of Montana, has cases. Of those cases, not all of them are related. That means we have community spread happening right on our state's borders.
North Dakota's vaccine rate for kindergartners in the county where the outbreak is occurring is just 81%, well below the 95% herd immunity target. Krininger says Montanans deserve to know the vaccine rates and the risks in their communities despite changes in state law. Is there anything preventing a concerned parent or member of the media calling up and saying, hey, what is the vaccination rate?
No, not to my knowledge. There's nothing that prevents us from sharing that information.
So the bill in 2021 said they're not mandated to provide this information. The school districts aren't. But does that preclude them from providing it if they want?
Yeah, no, it does not preclude school districts from proactively providing aggregate information.
So Montana PBS called numerous school districts across the state and asked them to provide their vaccination rates. Most of the large school districts are above the 95% herd immunity threshold, but Hamilton reported an 89.5% vaccination rate, and Great Falls sits at 84%. The Bozeman and Kalispell public school districts are working to provide their rates under Freedom of Information requests we filed. At airtime, we did not have those numbers yet. And the Corvallis School District declined to provide its vaccination rate. Williamson says she's not surprised some school districts are declining to provide the data.
We are no longer asking them for it because we suspect that the schools that are in communities that have good vaccine coverage would probably be the ones that report, and maybe some that are in communities where vaccination coverage is low or whatever. We just might get some skewed data.
Great Falls stands out as the biggest community that reported a lower vaccination rate. Great Falls has an 84% vaccination rate.
Yikes.
What do you think about that?
I think it's highly, highly concerning.
84%, I would be really nervous
Because of the 2021 law, it's not publicly known if there are lower school vaccination rates across the state. And it may be at least another 2 years before we have current school vaccination rates. Representative Cunningham's bill died in the Senate, even while Montana was seeing its first measles cases in over 3 decades. After her bill failed, Cunningham met with the Gianforte administration to see if they would ask school districts to report vaccine data anyway, but they declined. Meanwhile, the children who were born under the expanded exemption laws are just beginning to hit preschools and kindergartens.
All right, thanks so much. Great to see you again.
Great to see you.
So, Representative and pediatrician Cunningham isn't going to stop fighting to make vaccine rates available. She's planning to take another swing at the issue if she's elected to a second term.
I think information is freedom. We all make decisions based on information. And so I think people have the right to have that information.
As pediatricians, we don't mean to scare people, but we also want people to, live a happy, healthy life. We want kids to grow up and ride bikes and swim in the creeks and do all the things that we love to do in Montana.
Dr. Moriarty and Dr. Cunningham know that parents also want that for their children. That's why they believe families should have the best information to assess risk and make informed decisions in the midst of what's shaping up to be the largest U.S. outbreak of measles in more than 20 years. For Impact, I'm Anna Rao.
If pregnant women were previously vaccinated, then their babies have protection from the measles for the first 6 months of life. Also, if an unvaccinated child or adult is exposed, they can receive an emergency dose of the vaccine within 72 hours to lessen the severity of the disease.